Hi everyone! Today I'm going to talk about one of the reasons why weight loss can be so frustrating for some people. I am so fortunate to have a job as a naturopathic doctor where I get to work with people who are very motivated and being really proactive to take lifestyle measures to be healthy. And it is totally true that there are lots of different body types and that healthy comes in all shapes and forms, so does unhealthy. But there is nothing wrong with wanting to see some changes in your body shape from your hard efforts. I frequently have women come into my office that are trying really hard to eat well and get in a good amount of exercise, but they're really frustrated because they're not seeing any changes in their body shape or their weight. And I really believe that it shouldn't be that hard and that there often is a reason why that is not happening more easily. So I'll first look at their diet and the type of exercise that they're doing. It is possible to be exercising too much or too little or not the right type. I'll also look to see if there's some issues with chronic stress. But I also often encourage people to get blood work done to look at their thyroid function, to check for any blood sugar imbalances. Something called insulin resistance can definitely be an issue, as well as other hormonal imbalances that can make weight loss really difficult. So I'm going to address each of those issues in a separate video. Today I'm just going to talk about what you can do to make sure that you've been tested properly to see if your thyroid is functioning optimally. So thanks so much for joining me this afternoon. For those of you that don't know, my name is Dr. Jennifer Hessler. I'm a naturopathic doctor and a mom of 3 and now 3.5. And I am passionate about helping people to more easily be able to incorporate healthy eating, effective exercise, stress management techniques, and a better understanding of how to help their bodies function optimally so that they can feel their best. So like I said, today I'm going to focus on the thyroid and the important role that that can have in either helping people lose weight or not lose weight. So when I ask patients if their thyroid has been checked, their response is often that their medical doctor has told them that everything is fine. And when I request a copy of their blood work, I often see that only their thyroid stimulating hormone, which is also called TSH, has been checked. So from my perspective, that only shows a piece of the puzzle, and we need to look a little bit deeper to have a better understanding of how the thyroid is functioning. So I'm going to go into a very brief physiology explanation of how our thyroid works. That thyroid stimulating hormone, or TSH, is produced in an area of our brain called the pituitary gland. And it is made in different amounts depending on how much T4, or thyroxine hormone, is being made by our thyroid. So if we have lots of thyroxine, our TSH level will be low. If we have too little thyroxine being made, our TSH level will be high. So hypothyroid has lots of TSH, hyperthyroid will have smaller amounts of it. So that T4 then needs to be converted into T3, which is the active thyroid hormone. And that conversion requires things like zinc, selenium, and iodine. Things like stress and hormonal changes, blood sugar imbalances, and illness can also affect how efficiently that T4 converts into T3. And there can be other factors at play as well. Normally, our immune system is supposed to help us fight external pathogens, things in the outside world that could be harmful. But sometimes the messaging gets wrong and our immune system starts to make antibodies against ourselves. So that's called an autoimmune reaction. And there are several antibodies that our body can make against our thyroid. If that's happening, then those thyroid antibodies will bind to the thyroid receptors and make it much more difficult for the T3 to bind to those receptors, even if it is present in adequate amounts. So I explain it like there's another key in the lock, so therefore the key that's supposed to fit in there can't get in there and do its job. So a lot of patients that I see have normal TSH levels, but they still have many of the symptoms of hypothyroidism, which can include difficulty losing weight, cold body temperature, hair loss, dry skin, constipation, so things that to some degree many people experience. But it's like if it's the thyroid that's the cause, the thyroid just isn't revving their engine enough. So that can be because there is too little T4 getting converted into that active T3, or it can be because there are some of these antibodies present against the thyroid. So the thyroid panel that I like to run on patients, what I consider a full thyroid blood workup, would include the TSH that's often done, as well as the T4 levels, the T3 levels, and I don't check all of the antibodies, but I do like to check the one called the thyroid peroxidase antibodies. And that will usually give us a pretty good idea. So once that testing has been done, you have much more information to determine if your thyroid is functioning optimally or not. And then there's a much more directed treatment plan that can be done to help you. So if the T4 level is good, but T3 is too low, then using some of those converting nutrients in a supplement form can help to get the T3 level up. If antibodies are present, then I've seen really dramatic changes in their number by using certain herbs that help to break down those antibodies, while at the same time eliminating any food sensitivities if they're present and healing the gut. Because most of our immune system is centered in our gut, and that's often where immune imbalances can stem from. If stress or blood sugar issues are a factor, then they also need to be addressed. So you can quickly see how complex our bodies are and that things don't work in isolation. There's never like a simple one size fits all, but there are definitely things we can do to figure out what might fit best. So if some of you feel after hearing this that this may be an issue for you, then I recommend seeing a naturopathic doctor or someone else who is trained in understanding the full thyroid panel to see what can be done to help you. If you live in Port Elgin, then I would be happy to be that person, or in Saugeen Shores, but there are lots of other great trained professionals who could also help in that area. And you also need to make sure that you're doing what you can to eat a balanced diet, exercise in the right way, as I've said before, manage your stress. That was one of the big reasons why I created the Your Best Life online program, because I wanted to be able to help patients more easily incorporate these lifestyle elements, and people who are not patients be able to incorporate these lifestyle elements that I see are fundamental to helping people feel their best, both physically and emotionally. So for those of you who are interested, the next group will be starting online on June 5th. And the link with more information will be posted in the comments for this video. So I really hope that you found this information useful. Please leave me any comments or questions. I look forward to your feedback, and I hope everyone has a great weekend. Thanks so much.